to St. Antoine Genetic Counseling. My name is Dr. Wycamp.
And I'm Dr. Turk, and today we're going to talk about ocular albinism and how it may affect your family.
Ocular albinism is a recessive condition that reduces the coloring or pigmentation of the iris, which is the colored part of the eye, and the retina, which is the light-sensitive tissue at the back of the eye, and pigmentation in the eye is essential for normal vision.
Unlike some other forms of albinism, ocular albinism does not significantly affect the color of the skin and hair. People with this condition may have a somewhat lighter complexion than other members of their family, but these differences are usually minor.
Ocular albinism is characterized by severely impaired sharpness of vision and problems with combining vision from both eyes. Although the vision loss is permanent, it does not worsen over time. Other eye abnormalities associated with this condition include rapid, involuntary eye movement, eyes that do not look in the same direction, and increased sensitivity to light. Many infected individuals also have abnormalities involving the optic nerves, which carry visual information from the eye to the brain.
A lot of questions we get from the parents are usually how frequent this condition actually is. The most common form of this order, ocular albinism type 1, affects at least 1 in 60,000 males. The classic signs and symptoms of this condition are much less common in females. XLOA, or X-linked ocular albinism, is a condition that is considered X-linked if the mutated gene that causes the disorder is located on the X chromosome. In males who only have one X chromosome, one altered copy of the GPR143 gene in each cell is sufficient to cause the characteristic features of ocular albinism.
Because females have two copies of the X chromosome, women with only one copy of the GPR143 mutation in each cell usually do not experience vision loss or other significant eye abnormalities. But they may have mild changes in retinal pigmentation that can be detected during an eye examination.
Exactly how the reduced amount of pigment leads to reduced visual acuity and sensitivity to sunlight is not yet clear, nor is it necessarily true that the pigment itself is primarily responsible, but rather some other developmental pathway in the assembly line of the eye and of visual development. There's also no effective treatment yet discovered.
Another common question you may have is when can the condition be diagnosed? And that depends on the care with which the parents look for subtle changes in their newborn infants.
Oftentimes it develops between 3 weeks and 8 weeks after birth. The sensitivity to light may not be appreciated for many months, and the reduced visual acuity may not be detected until an infant is cooperative enough to understand the task of recognizing features, numbers, and other objects.